Good afternoon, everybody. My name is Michelle Williams, and I'm here today to present stress and heart health. And hopefully, my goal is really to provide a lot of information about stress itself so then we can understand how we can sort of maybe make some changes to our lifestyles or to our decisions in order to reduce our overall stress so that it has less of an impact on our overall heart health. I've been doing health education for a long time, about 23 years, and stress is probably my favorite topic. So hopefully I can give you some good information that can be helpful to you. So with that, let's go ahead and get started. So first off, I always like to give a little bit of information about what stress is exactly, right? So it's important to understand that stress is a reaction to a stressor or a thing that causes a person stress. So the word stress is really not tangible. It's not something that you can hold. It's something that you understand and perceive. So it kind of has a little bit of a different intellectual sort of um, aspect to it that isn't so easy to understand because it's very different depending on the person and the situation and the experience and so on and so forth. But it's important to understand that it is a response to a stressor. Stress overall can be acute or chronic. As humans, we were meant to have acute stress, right? Where it's like, this is something that is causing this human difficulty, potentially sort of increasing their risk of death. So we need to make them aware and help them get through that situation. So you've probably heard of the concept of fight or flight. And what that means is that we are given the ability to either fight from this stressor or flight from it. The important thing to remember is that this is all based on evolutionary science, right? So 20, 30,000 years ago, our stress was related to things that would kill us. Not enough water, not enough food, wild animals in the place that we were, another group of humans coming to take over the land that we made, whatever the case may be. And so the fight or flight response worked really well because it allowed us to have the energy and the wherewithal to make quick decisions and figure out how to save ourselves. But when we fast forward to today's environment, hopefully none of us have an animal chasing us or not enough food, not enough water. So most of our stress is related to things that aren't going to kill us. So the fight or flight response doesn't necessarily help us to deal with said stressor. And so part of understanding how to deal with stress is to recognize what types of stressors cause a negative reaction in yourself, and also what types of things help with the physiological and emotional aspects of your overall stress. So, first and foremost, it's important to recognize what causes you stress. And when I say that to people in sessions that I teach often, most of us identify things like family, finances, work, right? Those are kind of the top three. But what is it within those major macro level identifiers that actually causes you the stress? Because if everything about your job was stressful, you probably would switch jobs. If everything about your family was stressful, you would probably run away. So it's important to recognize the things that not only support us and help us feel good, but also recognize the things that are making us feel bad or making us feel overwhelmed. And if we can identify those things, then we can say to ourselves, okay, I feel very stressed when I'm running late for something. So that would teach me to identify some time management techniques that can help me not be late so that I don't experience that stress anymore. So it's really important to know what makes you feel stressed on a very specific level. And of course, like I mentioned, it can be different for everybody. Some people don't worry about what other people think, or don't worry about being late, or don't feel stressed over an argument with a friend, or any number of other things, and other people do. So who are you, what bothers you, what causes you stress, so that you can then develop some sort of strategies to help you with that. Overall, stress can't be prevented. So I hear people say like stress prevention class. I think most people call it stress management class now, but I've been doing it for so long that, a long time ago we thought we could prevent we could prevent stress. But it's important to recognize that instead of looking at ways to prevent it, we want to learn to control our response to it. We want to manage the things that are happening in our lives that cause it, and we want to try to minimize the negative reactions that we have to it. And so controlled, managed, and minimized. It's also important to recognize that, or at least I feel like when we think about all of the different things that cause people trouble with their health, we can see that stress is a big one because it not only impacts your cardiovascular health, say, which we're going to talk about in a little bit, but it also impacts things like how much sleep you get and what types of foods you eat and uh, whether or not you exercise. So it sort of has direct implications on our health, and it also has these other indirect issues with our health. 1 to 3 doctor visits we think can be attributed to stress, including things like digestive problems and chronic pain and anxiety, depression, fatigue, so many different things. So people go to the doctor, they have these symptoms, and the doctor prescribes this or orders that test or suggests this type of therapy, etc. But at the very base or root cause of many of these problems is a person's stress. So without controlling the stress, the symptoms are just going to continue on and on and on. So it's important to recognize that stress plays a role in our ability to be present at work. It plays a role in our levels of energy. It plays a role in whether or not we're sick and how long we're sick for, how much pain we experience. It increases systemic inflammation. So when you hear people talk about anti-inflammatories and you hear people say that they have some of these symptoms that are associated with inflammation, that's not only caused mostly by our stress, but also by our body's access to certain toxins. So toxins in food, toxins in the environment, even toxic emotions can cause that sort of response in the body. So it's important to get it under control, understand what causes, how it is caused in our own lives, and recognize that, for the most part, whenever we feel stress, whether it's emotionally or physically, it does have a physiological response of the fight or flight. So it's going to increase your heart rate. It's going to constrict blood flow. It's going to give you short um, bouts of breath, so many other things, because it's preparing you to survive whatever is going to attack you, as it were 20 or 30,000 years ago. So same type of reaction, just that we have a totally different environment overall. Okay, so some heart health by the numbers as they're related to stress. I think it's important to recognize that even in young adults, we can see that stress has an impact on mental health, heart disease risk, chronic illness, and overall physical health. So much more prevalent, of course, as we get older, depending on which category we're talking about. But it is affecting people even from the youngest of ages. And I see this a lot in my own kids. I have a 16-year-old and a 12-year-old, and I see them experience stress, and I'm like, listen, it's okay. The things that you're worried about are going to get better, and it's like are we have like a sort of a stress badge where it's like, okay, this is how I'm supposed to feel. And ultimately, when we feel that way day in and day out chronically, it does start to have an impact on our overall health. Okay, so how does stress impact the heart? So that's kind of what our focus area is for today. So first and foremost, it's important to understand that the fight or flight response kicks in to drive some sort of fast-paced hormones like adrenaline and norepinephrine. And when those hormones get pumped through your body, it increases your blood pressure because the goal again is to fight or flight from something. And in order to do that, you need blood and oxygen running to your brain and all the parts of your body as quickly as possible so that you can move fast, be strong, make quick decisions. Because of that, if it's chronic and that's happening day in and day out, 24 hours a day, that can cause your arterial walls to have reduced flexibility, which can weaken the walls overall, and it can lead to risks for heart events, blood clots, and even some people think aneurysms. Over the years of this type of style, that can lead to more severe heart health issues like heart attacks and strokes and vascular diseases, etc. We also know that it can increase shortness of breath because, again, when we're trying to move fast, right, our body's trying to get oxygen in as fast as possible. And so the best way to do that for those short periods of time, hopefully, is to take a quick breath, quick out, quick in, quick out, because you're getting oxygen flowing quickly. When you take more long longer and sustained breaths, you're breathing in a lot of oxygen, and then it's taking you like, 5 or 6 seconds to breathe out the carbon dioxide before you can breathe in again. And so while that's the best way to breathe, on a day-to-day basis, if we're trying to move fast and get oxygen to our brain and large muscles quickly, then short breaths make sense. So your body's sort of pre-programmed to respond to that, which is good. But when we have chronic stress and we're doing that all the time, we're actually hurting ourselves, because it can make symptoms of respiratory diseases worse, or asthma. It can make it so that we get a tightness in our chest. It makes it so that we sometimes feel lightheaded or dizzy. I mean, there's all sorts of different things that can happen from that. We also know that long-term stress is linked to chronic systemic inflammation, which is what I was mentioning early on today. But, overall, we know that almost every disease has a precursor of inflammation, whatever that happens to be. So, in discussing heart diseases, when the heart muscle is inflamed or the heart lining is inflamed, those are all parts of diseases at the very beginning before they develop into more serious situations. So, for a lot of people, they'll get diagnosed with, high blood pressure, or um, atherosclerosis, or um, they'll have anxiety and things that make it so that our heart is pumping too fast all the time. So, we want to try to reduce inflammation overall, because we really only want our body to get inflamed when it's trying to do the work of the immune system, which is meaning that we get a virus, or we get a bacteria, or we get a fungus or something, and our body is trying to fight those things. We don't want to cause inflammation just from being, because again, the body doesn't work as well when it is inflamed. We also know that, generally speaking, two things. One is that overall stress there's a finite amount of energy that we have. So when we have a lot of stress, our energy depletes faster. Because of that decreased energy, we can also have issues with our heart health, because we can feel like overwhelmed more easily. We oftentimes don't want to exercise, and we know that there's a lot of preventative aspects to exercise. We tend to practice less, lower quality self-care, and that includes things like what we choose to eat, how much we choose to sleep, and those things all affect our overall heart health as well. So there's different types of stress and heart diseases, but important to understand that, people suffer from both emotional and physical stress. They both cause the same um, process of a reaction, but there's just different outcomes, right? So with emotional stress, of course, it's more involved in the brain and the mind. This is where we're processing emotions, so fear, anxiety, cognitive type and emotional type stress. fMRI studies, which are MRI, where they can see the hormones release and the reaction instead of just the images, right? Show that during this type of stress, the amygdala, which is the little tiny almond shape pieces of the brain that control our stress response, are triggered during these types of responses, or these types of emotional states. On the physical side, physical stress can, of course, increase overall our resting heart rate. And that is one of the leading, you know, um, number things that we can sort of follow to see our heart health. Now, I will tell you, most doctors are not tracking your resting heart rate. I think they should be, but I'm not a doctor. So, but what I will say is that if your resting heart rate changes over time, and you're taking it sitting at a desk, or watching a webinar, or watching I don't know, reading a book or whatever, and it's going up, that means that your heart is having to work harder at rest than it did before, which tells most people, physiologists, that your body is having to work harder to do the same thing. So that's a really important number that, if you're interested in kind of monitoring your heart health, that might be a good number. That is not necessarily one that's followed in medicine, but can be at home. Increased heart rates overall have been linked to a later development of diseases of the heart. So what we see is that people who suffer from things like high blood pressure and tightening of the chest wall, anxiety, chronic stress, etc., tend to then later in life develop some of these diseases of the heart. So we know that there is a link between physical stress, emotional stress, and heart disease overall. So a little bit about heart disease, because I think it's important to understand that there are quite a few different types. Arrhythmia is just an abnormal heart rhythm, not necessarily an issue. It depends on why the arrhythmia is occurring. Atherosclerosis is the hardening of the arteries. This can come from poor diet, high stress, smoking, of course, different types of chemical influence. Cardiomyopathy is a condition that causes the muscles to harden or grow weak. That can be caused from lifestyle and also just genetic or hereditary reasons. Congenital heart defects are those defects that a person is born with. Many times, we don't know that somebody has a heart defect unless it's really obvious, right? So what they see is people who have heart events younger than the age of 60, 62, tend to, or at least they kind of get categorized into, oh, these people probably had a congenital heart defect. If, especially if they didn't have a poor lifestyle, if they didn't smoke and they ate healthy and their stress level was kind of average, then we start looking at things like, well, what happened when the heart was developing that it didn't develop properly. CAD, or coronary artery disease, is what is the when we say heart disease, and the numbers of people that in the United States that are impacted by that, that is caused by a buildup of plaque in the heart. And the vascular system overall. Predominantly, that's caused by things like smoking and poor diet, sedentary living, that poor sleep habits, etc. And then lastly, there are some diseases associated with heart infections. So maybe the person gets a bacteria or a virus or a parasite or a fungus or something that gets into the vascular system. But certainly CAD is the most common, and that is also the one that tends to be very much connected to stress itself versus the other ones that are sometimes caused by other things. Okay, so moving on, how can we manage heart health overall? So just like everything else we talk about in the wellness world, it's these sort of four things, right? Exercise, sleep, stress reduction, and of course, nutrition. You could obviously add some other things in there, but overall, it's important that we exercise, because when you're exercising, you're working out your heart. Your heart is a muscle, just like any other muscle in your body. If you don't use it or work it out, it will get weaker and not function as well as it could. So, moving as much as possible, strengthening the walls of the arteries through cardiovascular exercise. We know that when we get our heart rate up to its target heart rate for 20 minutes or more per day, we do have positive health benefits from that. Everybody's target heart rate is figured out the same way. So you would do your maximum heart rate, which is 220 minus your age. So if you're 40 years old, your maximum heart rate is going to be 180. And then you would, for your target heart rate, you would take between 0.65% of your maximum heart rate and 0.85. So 0.65 times 180 if you're 40 is your low end of your target heart rate, and then 0.85 times 180 would be your high end range of your maximum heart rate. When we're talking about sleep, I think this is sort of a newer thing that we talk about in wellness within the last decade. I know that when I first got into wellness, we never talked about sleep or mental health. It was all exercise and nutrition, maybe a little bit of stress. So I think it's really great that we're exploring how important sleep is. The more I read about it, I just think to myself, I got to get my 8 hours, because this is when your body's repairing itself. It's taking out the toxins from our body. It's recharging our energy. It's building our immunity. It's balancing our hormones. It's moving short-term memory to long-term memory. All of these things are very important for overall well-being. So, I encourage everybody to start with sleep and then move on to stress and get to exercise and nutrition once those two things are in place really well. When we're talking about stress and ways to reduce it, there's lots of different things that we can talk about, but it's really about identifying, of course, what's causing your stress, and then some things that work for you. So, for me, I practice breaks. I work for about 45 minutes to an hour, and then I get up and I walk around, whether that be to get a glass of water, make a quick phone call to a friend, whatever the case may be. But it allows my brain to like take a break, reset, and get so that I can get right back into it. Some people really benefit from mindfulness, meditation, thinking about how they manage their time better, practicing good self care, reducing their media exposure. Certainly, there's a lot of stress there. And then, of course, thinking about other things that could cause us stress. So, excessive use of caffeine and other stimulants, excessive use of sugar, alcohol, exposure to toxins, etc. When we think about how important nutrition is in regards to heart health, it's like if you have a lot of stress, then we really want to try to manage it. But if that's difficult to do right out of the gate, really looking at your nutrition, because nutrition plays a huge role in our heart health. And if we have a good nutrition foundation, then the stress that we might experience may have less of an impact on our overall long term heart health. So when we're thinking about nutrition, are the foods that we're eating nutrient dense? Are we getting enough water? Hydration is really, really important for heart health overall. Are we balancing our eating? Are we regularly eating foods that are good for us? Saturated fats and salt, not so great when we're talking about heart health. So we're trying to reduce things like the three S's: sugar, salt, and saturated fat. And we're trying to increase things like omega 3s and EPA and DHA and antioxidants and other things that are helpful to our overall well being. So, if you are someone who is experiencing a lot of stress, we want to learn to recognize when it's too much. So, again, this is very different for everybody. It's a spectrum, just like every other thing that human beings experience. But if you're waking up after a full night of sleep and you still feel tired, that could be a couple of different things. But certainly, it could be that we're just so overwhelmed that our sleep isn't restful, right? We might be getting the number of hours, but we're not getting the quality, right? So it's not always just about quantity, it's about quality. If we lose our temper easily, when we have a lot of stress, our emotions are more difficult to handle because, again, if you think about human beings 20,000 years ago, our stress was related to things that were going to kill us most likely. So we didn't, our brain sort of stopped our digestion, our sexual desire, our emotional control, and other things that you didn't need at the moment of survival. So then you kind of look at it and you say, okay, well, those are the symptoms that we're going to get. We're going to get digestive problems. We're going to feel overwhelmed. We're going to feel irritable. We're going to get muscular tension. These are all symptoms of long-term chronic stress because our brains are sort of destined to put those things on hold so that it can really focus on helping us survive. So some other things that you might notice in your own body is, that muscular tension where you feel real tight around your neck and sometimes in your lower back. Maybe you have racing thoughts that you can't control. That happens to people, particularly when they sort of turn the light off and then all of a sudden their brain is like, ah, that's a sign of being, close to burnout. You might notice some digestive changes. Maybe you have diarrhea, maybe you have constipation, maybe you have gas, maybe you have stomach pain. For some people, it will impact how they eat, when they eat, what they do with their body when they go to bed. They might have unexplained changes in their weight, gain, loss, maybe just muscle loss. It depends. For some people, they have headaches or migraines, or they might feel nauseous or throw up even. So there's all sorts of different things that where your body is telling you that you have too much stress. So it's up to us to sort of recognize those symptoms and try to do something about it so that it doesn't have that long-term impact on our overall heart health. So some things that we can do for stress reduction overall, certainly, long-term stress again is the kind that we're really trying to manage. When we manage the stressors that go on for long periods of time, we have a greater impact on our heart health. Short-term stress doesn't usually have that same impact, or at least that's what it seems like according to the research. So we want to think about the things that are not bothering us right in this moment, but things that are, kind of bother us day in and day out. So one of the things that we talk about a lot is the 7 test. And so the 7 test is Is this going to bother me in 7 seconds, 7 minutes, 7 hours, 7 days, 7 weeks, 7 months, 7 years? Seven of them, right? So if it is 7 seconds, minutes, hours, or days, we got to let it go, right? The things that are 7 weeks, 7 months, 7 years, those are things to really, consider and try to change our lifestyle about. But the things that are going to be over in a week or less, we have to sort of try to let that go. Those that process can be really difficult for a lot of people, but certainly these can lower trying to sparse out those two so that we are really only stressed about the things that like quote unquote matter. That can have an impact on not only our heart health but also reducing our systemic inflammation, and it could even um, reduce the pain associated with things like fibromyalgia or other disorders of the immune system and digestive system and so much else, because we really do see that stress is connected to all of those. Reducing stress in general requires that we do something different, right? Because the thing that we're already doing is what's causing us our stress. So that it requires a conscious choice to make a change, and a deliberate decision about how we're going to spend our time and what we're going to focus our energy on so that our stress is controlled. And that makes a significant change. So of course, we talk a lot about the importance of relaxation. In today's world, there's a lot of chaos. There's a lot of stimulation. There's a lot of marketing. There's a lot. So trying to remove yourself from some of that and practice relaxation and practice setting up boundaries around, say, media or certain people even. It just sort of depends on what bothers you. Like for me, I can only watch so much of the news before I'm like, oh my God, forget it. I don't actually really watch the news a whole lot, but I'll listen to it sometimes just so I can stay abreast on what's going on. But, overall, there's a lot of things out there that can cause us stress. So if we can start to recognize what those things are, we can sort of put up some boundaries so that we're not exposed to it 24 hours a day, 7 days a week. Relaxation techniques can be very helpful. They can help your body slow its heart rate, activate the vagus nerve, and to sort of reduce the beats per minute, right? Because when we're highly anxious or we're very stressed, our BPMs go up, our heart works harder, and all of these things kind of go hand in hand. So we want to sort of try to do some deep breathing, try to do some meditation, some relaxation, some prayer, whatever works for you, in a way to find some peace and some moments of relaxation and disconnect, because all of those things are really important. So spending time in nature, getting the grounding effect, practicing some deep breaths, listening to a story on audio, whatever the case is, whatever works for you. But again, that's where a lot of this comes into place. Is like, how well do you know yourself, and what sorts of techniques work for you, and what sorts of things like make your stress go from here to here. When you can figure that out, you can slowly start to say, okay, that thing stresses me out. So what am I going to, and I have to do it. So what are some things that I can do to practice good self-care so that before that situation happens or starts, I'm much more calm, right? If you go into a situation that causes you stress, when you're already stressed, it's like from 0 to 100. And I think probably all of you, including myself, have experienced that before. So, what are some immediate changes you can make in your lifestyle? So, first, like I mentioned, recognizing your own personal stressors is a big step. Two, understanding how those stressors impact, or how the stress response in your body impacts you, your physical body. Also, being aware of your breathing. I know that that's a big one for me. I often hold my breath when I'm very stressed. So I have to say to myself, and I sigh a lot. And then people will say, "Why are you annoyed?" And I'm like, "Oh, I'm not annoyed. I just realized I wasn't breathing." And so that's a big piece of it. Consistent breathing helps our body get the oxygen it needs, so it doesn't turn on the alarm of stress. So knowing how you respond to things can be a really big piece of all of this. Some people have an overexcited stress response where they get keyed up, they get overly emotional, highly energy, agitated, angry, anxious, etc. And other people have an underexcited stress response where they become just depressed, withdrawn, isolated, spacing out, etc. So, what type of person are you? Do you fluctuate between the two? But again, the more information you have about how you personally react can help you with managing some of the stress that you might experience. Some short-term changes are acknowledging the stressors that you have and understanding that, we have to make a change in order to see a different outcome. Um, Trying not to over intensify the stress that we're experiencing. There's also different essential oils and teas and things that we can do to help our body overall. Stretching every day can be a good part of it because that sort of connects mind to body, which sort of brings everything back together. Like I mentioned, exposure to nature. Some people have found a lot of help in practicing a gratitude journal or in having some sort of routine that helps them calm down overall. And then, of course, having some goals because, like I was saying before with the 7 test, if you know that one of these stressors is helping you get to something that's really important, then you can sort of say, okay, this stress is, worthwhile, and that can be helpful. Long-term changes that we can do over time, decluttering our house. Clutter can cause stress. Certainly making sure that we have a good time management system and we know how to prioritize, plan appropriately, etc. Developing a support system and having people that you can ask for help with certain things. Focusing as much as you can on what is happening right now, because when we focus on the past and the present, the past and the future, that can cause a lot of stressful experiences for us. And think about how you use language, because when we say you always do this, or this always happens, or this never happens, or whatever, those types of things kind of set us up in this box so that when it's not always a never, which is probably 98.99999% of the time, we're like, oh, this is causing me stress. So it can be helpful to sort of change our own internal perception. So that's all I have for you guys today. I hope that was helpful, and I hope that you can find a couple of ways to manage your stress a little bit better moving forward and reduce some of those risks for chronic heart disease issues. Thank you so much for attending today, and have a nice rest of your week. Bye-bye.